Great. Well, welcome everybody. I'm pleased to be here today. I'm Dr. Kevin Churchwell, President and CEO of Boston Children's Hospital. And I'm very much pleased to welcome Governor Charlie Baker and Commissioner Margaret Cook to Boston Children's. And especially pleased that we are here today to talk about pediatric vaccination. I know this is a day that we at Boston Children have been waiting anxiously for. I just mentioned to the governor that we're in the Enders building, and this is the building named after John Enders, who led the work in the creation of the polio vaccination, the polio vaccine. So I think that that makes a difference in what we're talking about today. With the Food and Drug Administration authorization of the Pfizer-BioNTech COVID-19 vaccine for emergency use in children's ages 5 to 11, and the Centers for Disease Control and Prevention sign-off, we are prepared to begin vaccination of pediatric patients in Massachusetts starting tomorrow. And so this is great and exciting news. And Governor, I hope I didn't bury the lead in saying that. Dr. Frini Polanco-Walters of our Division of Adolescent Medicine is here, and she will speak to the safety and efficacy of this vaccine in young children. Suffice to say, with children under the age of 12 unvaccinated, they have been and are risk for serious disease from COVID-19. We do continue to see cases where children contract it, get very ill, and are sometimes hospitalized. This virus is extremely contagious and spreads rapidly. And I do want to stress, that's probably the most important thing that I will say today. Vaccination of children will protect them and will slow the spread of this disease to the unvaccinated and to other very at-risk individuals. Vaccinating children will reduce the toll of this virus on everyone. The availability of the vaccine in younger children offers a tangible opportunity for all of our children to return to more normal daily activities and routines, and that's critical to their well-being. The vaccine will protect them against getting COVID-19, a very real concern. And it is my sincere hope that a robust turnout for our vaccination efforts with children will also mark the beginning of a return to the routines, the typical school days, activities, and community supports that are so many of them have been missing and are so vital to their mental well-being. So thank you for joining us today. And I'll stop there and turn it over to our guests.
Good morning, everybody, and I want to thank you again, Dr. Churchwell, for hosting this event today. I would say the last time I saw Dr. Churchwell, he and I were getting our heads shaved together to raise money for, I think it was pediatric cancer, correct? And I'm glad to see that you seem to have fully recovered from that experience. I also want to thank Dr. Frini Polanco-Walters for being with us today. Grew up in Boston, went to Rhode Island for college, went to New York for medical school, and then came back to the Commonwealth to practice. And we're also joined by Acting DPH Commissioner Margaret Cook, who will also have a few words to say as well. I want to thank Children's not just for hosting us today, but for everything you folks do every single day here in the Commonwealth of Mass for so many people, not just in Massachusetts, but also for kids around the country and around the world. As everybody knows, the CDC approved the Pfizer's pediatric COVID-19 vaccine for children ages 5 to 11. Vaccines have started to ship to Massachusetts last week after the FDA issued its emergency use authorization, and pediatric doses are here and more will be coming. We don't anticipate any supply issues, which, as we all know, back at the very beginning of this were a significant concern. We continue to lead the way in vaccinations here in the United States, with over 5.5 million people in Massachusetts having received a first dose and In Massachusetts, typically, if you get a first dose, you get a second dose, which has been a great statement, not just about the vaccine delivery system, but about the commitment of the people in Massachusetts to getting vaccinated and to keeping themselves and their families and their friends and neighbors and coworkers safe. A big part of the success of vaccinations has also been the program for kids aged 12 and older who've been eligible for the vaccine since the summer. Over 80% of kids aged 12 to 17 have gotten at least one dose, and our youth vaccination rate here in Massachusetts is about 20 points higher than the national average. For months, we've been preparing to distribute vaccines across the state so that families would have easy access once they were approved. And over the past year, we've built a nation-leading vaccine distribution infrastructure that's grounded in our relationships with partners like local boards of health, hospitals, pediatricians' offices, community health centers, and many other healthcare providers. We relied on these relationships to ensure the pediatric vaccine is widely available to families in every corner of Massachusetts. Over 500 locations to start will offer the Pfizer pediatric vaccine, including pediatricians' offices, pharmacies, community health centers, hospitals, and community-based clinics that are sponsored by both the Commonwealth and by local boards of health. With this mixed model of providers, nearly every Massachusetts child lives within 30 minutes of a vaccine clinic. We recognize that local boards of health and municipalities have a critical role to play here. That's why we've reached out to all of them to coordinate this process and to give them the opportunity to provide vaccines in their communities. For any local board of health that hasn't signed up to provide doses so far, this is an open invitation to those that choose to set up a clinic at a later date. We also know that pediatricians will obviously play a really big role here in this process because they are, in fact, in many cases, the most trusted partner for parents and families as they make this decision, and that's why we're particularly pleased to be here at Children's to talk about this today. We understand many parents will want to talk to their family doctors and to their pediatricians about the vaccine. These medical efforts know that the vaccine is safe and has been proven to be highly effective, and they are well positioned to help parents understand the facts so that they can make the decision that's best for them to vaccinate their kids. We're pleased to be joined today, as I said before, by Dr. Freeney Polanco Walters, a pediatrician here at Children's, and in a moment she'll talk a little bit more about how the vaccine is safe and effective for kids. As of today, parents can make appointments to get their kids vaccinated, and just like vaccinations for adults, the process is simple and easy. For parents who want to vaccinate their kids through their pediatrician or primary care provider, we encourage you to reach out to your healthcare provider directly. Parents can use vaxfindermass.gov to book an appointment for their children at a pharmacy or a local vaccine clinic, and some appointments at pediatric offices or hospital systems will also be available on the state's VaxFinder tool as well. Users will be able to narrow their results on VaxFinder to find locations offering the vaccine. Many locations have appointments that are available now, and more will be added, obviously, in the coming days ahead. People who can't use VaxFinder or have difficulty accessing the internet can also call 211, similar process to the one we had before, to access the COVID-19 vaccine resource line, and they can book an appointment there as well. The call center is open Monday through Friday from 8:30 a.m. to 6 p.m. and on weekends from 9 a.m. to 2 p.m. Translators are available in over 100 languages. As a reminder, the only pediatric vaccine that's approved is from Pfizer. And just like vaccinations for adults, it will require 2 doses that are 3 weeks apart, approximately 3 weeks apart. We encourage you to book that second appointment when you make your first. We're obviously excited to get underway with this pediatric vaccination program because we know the vaccine has been proven to be safe and effective. It's also free and available to every family in Massachusetts. We have the highest vaccination rate in the country, and as a result, our hospitalization rates and our case counts are among the lowest in the country. We strongly encourage parents and families to get the facts and to make the call to protect their kids. If you have questions, absolutely talk to your child's doctor. We've come a long way. A year ago, we hadn't received any doses of vaccine, and we were in the middle of fighting a fall surge in cases and hospitalizations. Today, vaccines are widely available across the Commonwealth, and millions of people in Massachusetts have stepped up to get vaccinated. And as a result, everyone who gets vaccinated is protected from getting very sick from COVID-19. In many respects, it's that simple. We look forward to working with our partners in the healthcare community to make sure that every family has easy access to these vaccines. And we look forward to having a successful launch and campaign to ensure that kids between the ages of 5 and 11 have the same opportunity to make themselves safe and to be family safe as their older brothers and sisters and their parents and their grandparents.